There is hope that a vaccine will make the difference in the fight against COVID-19, but after the virus has run rampant for nearly a year, there's a lot of work to do. As David Akin reports, vaccination programs are now underway across the country as many regions struggle to cope with rising case counts.
No feeling, it's just great.
You didn't feel anything?
A little bit, but not much.
Okay,
You know.
well that's
I'm
good.
used to getting needles.
In all her 84 years, Colette Gauvin has never had a needle like this one. She's the first in New Brunswick to get the first dose of the Pfizer COVID-19 vaccine. As a resident of a long-term care home, Gauvin and hundreds of thousands like her across the country are in the top priority group for the vaccine. And right after Gauvin, New Brunswick authorities administered first doses to an emergency room doctor, a paramedic, a nurse to seniors, and an intensive care nurse, all members of the key high priority groups for vaccines in that province and others.
I feel more at ease now going to work because there's always a chance of like an unknown. You don't know who's coming through the doors. And I'm just really happy that I can protect myself.
But the race to vaccinate enough Canadians to make a dent in case counts or mortality numbers will be a marathon run at a slow pace.
You're probably looking at pretty steady or even increasing mortality until you get most of the way through, more than half the population for sure. And I would think closer to 3/4.
After a week in which vaccination programs got underway, less than 10,000 Canadians have now been given the first of 2 doses of the Pfizer BioNTech vaccine. Rising case counts are putting stress on hospitals in many parts of the country. Canada's Public Health Agency said Saturday there are about 3,200 Canadians in hospital because of COVID-19, including 650 in intensive care units. ICU beds are in such short supply in Edmonton, for example, that at a children's hospital there, patients in pediatric intensive care units have been moved to make way for critically ill adult patients. And meanwhile, the country waits for the approval of the Moderna vaccine, and Health Canada hopes to give it the green light next week. David Akin, Global News, Ottawa.